Laser hair removal works by using a focused beam of light. When we shine it on the shaft of the hair, the pigment in hair actually absorbs the energy, turns it into heat, it flashes out and actually kills the cells inside the hair follicle. Now, there are many different types of lasers on the market. Some lasers are effective only for very light skin types. Other lasers you can use from African American skin to East Indian skin to any other skin in between. So the trick is with laser hair removal is that you should probably go to a clinic that has quite a few of these machines, at least 2 or 3 of the machines, so that whoever walks in through the door, you'll be able to match perfectly with the proper machine or proper laser for that person's particular skin type. Laser hair removal does hurt a little bit. We like to say that it feels as though it's a snap of a rubber band up against the skin. These laser treatments do tend to be they can be very short if you're doing, let's say, laser hair removal on the lip, but if you're doing a whole upper back or lower leg, it does tend to be a little bit longer, more painful. For that, some clients will actually take 2 Tylenols or 2 Advils or something like that just to take the edge of the pain off. Now, lately I've been seeing a lot of advertisements that show, they say that, oh, the laser hair removal is completely painless, and they take a laser, they just sort of wave it in the general direction of the area you're trying to treat, and the idea is to give bulk heating. In my experience, that doesn't really work that well. You tend to get temporary hair reduction as opposed to permanent hair reduction. It's quite variable, generally about 4 to 6 treatments. Sometimes we get hair that's very, very stubborn and it'll take more treatments than that. We've gone as far as sometimes 8 or 10 treatments, and other people 4 treatments and they're done. Laser hair removal is indeed safe in experienced hands. The lasers are actually quite powerful because they have to be. You need to send the energy deep enough so that you can destroy the hair follicle. But in experienced hands, it does tend to be very, very safe. Most of the times, if we do see any burns, it's usually from matching the wrong laser to the particular skin type or using the wrong laser to that person's skin. Oh, that's one of the first questions I often get. People will say, I'm going to get 7 or 8 treatments, will it cause cancer? So the short answer is no. The type of energy that is used in a laser is actually in the visible wavelength, so it's actually visible light. So while it's powerful enough to cause burns if used incorrectly, it's not powerful enough to change your DNA. For that, you actually need to have ultraviolet light, like the type that we see in sunshine. There are lasers out there. You will always find a laser to treat your skin type no matter the color. The problem is that not all clinics will have those lasers because they tend to be expensive. So again, you should go to a clinic that's a little bit larger, that has at least several machines so that you can be sure that you won't receive a burn or anything like that. Lasers don't work on every single hair color. So you need to have some pigment in your hair before the laser will work. And so if you have gray hair, white hair, blonde hair, or even very light red hair, unfortunately laser hair removal will not work. For that, you'll probably have to use the other conventional methods of hair removal, such as waxing, electrolysis, and so forth. Typically, when you first start the process, you have to come in about every 4 weeks. After you've had a few sessions, the hair comes back quite a bit more slowly, and during those times we can start spacing the treatments out to every 6 weeks, every 8 weeks, depending on which part of the area that which part of the body that you're treating. For laser hair removal, anywhere with hair you can treat. So our most common areas are bikini, underarm, legs, arms, even the upper lip or chest. We do sometimes do areas that are a little bit more sensitive, such as around the areola, the unibrow, sometimes even the ears and the nose. But I have to caution you, hair removal in the nose is rather painful. Laser hair removal, after you've gone through a course of treatment, is permanent in reducing the number of hair follicles and the number of hairs out there. So typically after you're finished, you might even see just a very light dusting of hair that you might have to shave once every few months or something like that. There are certain circumstances such as a polycystic ovarian syndrome. If you have that, unfortunately, the hormonal drive is so strong that the hair removal only gives you a temporary reduction rather than a permanent reduction.